So let's take a look at a couple of examples here, right? And so this is going to be looking at how reviewing documentation can directly impact your session delivery and why this stuff is so important. So, scenario A, let's look at skill mastery in an academic setting. So, imagine you're preparing for a session focused on academic skills. You check the data sheet for a target, and the target is identify all US states capitals. The data clearly shows 95% independent correct responses for 4 consecutive sessions. The action you should be taking is that client has met the mastery criterion. You immediately stop running the target. You check the written program steps and see that the next goal is locate all US state capitals on a map. You spend your session time teaching the new and more complex skill. Next, you read the prior session notes and it indicates the client responded poorly to vocal praise, and he responded best to 5-minute breaks access after every 3 correct trials. Your action: you prioritize the break access schedule as a reinforcer and reduce the amount of simple vocal praise and focus on higher value options to maintain the client's higher motivation and momentum throughout your session. And so, again, by looking at the previous data and looking at the previous text notes, you're able to notice that not only does the goal need to be adjusted, but also that motivation has been adjusted as well. And because you did this beforehand, you're able to do so before the session starts and you were able to have a successful session. Let's look at another situation. So, in this case, you have a challenge behavior and environment in a group home. So, you open the client's behavior intervention plan, BIP, and under reactive strategies, you find new instructions. If verbal aggression occurs, staff must immediately remove all attention. Turn away and stand 5 feet away for 10 seconds. Do not engage. The action you should take is you ensure you know this safety procedure by heart. You rehearse the neutral turnaway so your response will be immediate and consistent if aggression occurs, maintaining safety and procedural integrity. You then review the prior data and notice a significant increase in transition refusals, jumping from 1 per session to 5 per session on Monday. The action you take is you anticipate this difficulty. You proactively increase the value of your first then statements and reinforce compliance heavily during the first few transitions today, working to prevent the problem behavior from occurring in the first place. And so, in this situation, by reviewing the treatment plan, being familiar with the procedures, and being familiar with the difficulties early in the week, you're able to not only have a proactive and engaging session, but you're also able to keep yourself safe and that client safe. So, let's look at job coaching, right? And so, this applies to common, non-complicated jobs like stocking shelves or preparing mailers, right? Maybe you're helping an older client, to obtain a fulfilling work job. And so you review the program update for assembling mailers and see the instruction SD has changed from make this stack to the more concise start the assembly task. So your action is consistency is key, right? And so your action with this is you must only use the new SD, start the assembly task, even if the old wording is easier to say. And then finally, you read the prior note on the task. Client struggled with step 4, folding the pamphlet, and required moderate physical prompts all 5 times. So the action step is you anticipate this difficulty. And when you run the task, you proactively use a visual or partial physical prompt before the client makes an error on step 4, setting them up for success and teaching the correct skill sequence immediately. And so the key with this is by reviewing the notes and reviewing the updates, what you end up seeing is making sure that you're providing the program correctly and that the everyone in the entire team is working the same direction and they're all in step so that we can provide the best quality of services to our clients. And so, in conclusion, with professionalism and progress, it is critical that you review your documentation. It's not something that's tedious. It's how you ensure professional integrity and maximize the client's progress. By knowing the plan, the data, and the context, you transform from a staff member into a highly effective registered behavioral technician. And when you're doing that, you're ready to deliver confident, high quality care, which is what we aim to do and is what we should be doing for our clients.